If you offer umbilical cord tissue injections or are interested in how to start a stem cell clinic, there are 6 questions that come up in just about every umbilical cord stem cell products consultation I've ever observed. Some patients will ask them directly and some will not. Most of the people you speak with will make decisions based on the manner in which you respond to the questions, as well as if you cover the material that they found online. Either way, every single one of those questions is on the table from the moment the conversation begins. That potential patient will be grading you. In this video, I'm going to walk you through all 6, give you the underlying concern driving the questions, and a suggested response that's honest, clinically accurate, and basically is going to build trust rather than creating doubt, suspicion, and skepticism. Of course, your specific response will vary based on the type of practice that you have in your experience. I'm Dr. Roy Picard with Select Regen Solutions, and I help MDs, chiropractors, and nurse practitioners optimize their regenerative medicine office. This is one of the services that I offer on a one-to-one basis, and for most offices, this service can be complimentary. Be sure to subscribe to this channel so that you can learn how all of this is possible. Getting back to the consultation responses, this information will be as helpful for someone who is just learning how to grow a regenerative medicine practice, as well as the practitioner who is already running a successful regenerative medicine practice, but may need to tweak a few minor things here and there just to increase patient education. Let's get started with the first question. Where do you get these products from? Yes, the obvious concern is safety, but more specifically, what they're really asking is, am I going to regret this? Is this office going to put something into my body that could cause problems I don't know about yet? Obviously, you want to acknowledge the seriousness of the question before you answer it. For me specifically, this is a very easy response. Mr. Jones, I completely understand your concern because when I first started looking into these products back in 2017, it was for my father. I asked tons of questions to people that were directly and indirectly involved with biologics for regenerative medicine. The products we offer come from donated umbilical cords from full-term healthy babies and healthy moms. These are from C-section deliveries only, live births, and the process all the way to you receiving the product in our office must follow guidelines established by the FDA, National Institutes of Health, the American Association of Tissue Bank, and the American Association of Blood Banks. Every donor is screened for communicable diseases and viruses. These umbilical cord tissue products are immune system neutral, which allows for just about anyone to use them. We've administered thousands of these products and have not encountered any serious adverse events. A more potential side effect would be if the injection were administered in an unsanitary or non-sterile manner, and then you would run the risk of infection, and we've never had anyone report to us anything like that at all. I wouldn't offer something I wasn't confident in. And Mr. Jones, that's why most of our patients come from referrals from previous patients. All right, so that would be a reasonable response from a regenerative medicine practice. Obviously, there is going to be follow-up questions, but at least you created a solid, confident response, which is extremely important. Obviously, your specific wording will likely be slightly different, but when you deliver this information in a comfortable, confident structure, the patients will know exactly where you're coming from. Is this FDA approved? This question carries a landmine for someone who is totally unprepared when discussing biologics for regenerative medicine. If you start fumbling around or get defensive, basically it's game over. Whether it's addressing this question or any other question, if you can display the confidence in what you do, the honesty in why you do what you do, and not worry about the individual's response to what you say, to the right person for your regenerative medicine office, it opens the door to let them in. For the person who, for whatever reason, is not right, it opens the door for them also, but this time to let them out so that you don't have stress, conflict, or chaos continuing in your office. Mr. Jones, the products we offer are not FDA approved. The FDA approved and traditional insurance-based care guidelines for your knee pain will include treatments like drugs, physical therapy, chiropractic services, gel shots or hyaluronic acid injections, and surgery. People come to us when those services did not work or they're trying to avoid drugs or surgery. This is the reason that your friend Bill had sent you to see us. The FDA-approved procedures for knee pain don't have the ability to repair damaged tissue. Now, that's a short, direct answer for Mr. Jones that displays confidence and is definitely not what I would call apologetic. You're not trying to hide anything. You should take pride in the fact that you're not going to attempt something that is already proven not to work for a patient. When it sounds rehearsed or, God forbid, defensive, that individual will view you as some type of used car salesman. I strongly suggest that you role play this with your staff before using this during your consultations. You have the outline of what needs to be said. Your job is to personalize it for each and every individual patient. How much does it cost? Cost is the number one excuse people use to justify moving forward, but that goes with everything in life. Cost needs to be addressed by relating it to value. I know many practitioners hate when people ask this question, but it can really help you and your office when handled properly. Do not be apologetic for the price, and definitely don't jump into justification mode before value has been established. Mr. Jones, the regenerative medicine services we provide are outside of the traditional medical care and insurance-based guidelines for treating knee pain, where drugs, physical therapy, chiropractic services, gel shots, and even hyaluronic acid injections and surgery are allowed. People come to us when those services did not work or they're trying to basically avoid drugs and surgery. We offer a number of different types of services besides the different types of umbilical cord tissue injections when it comes to knee pain. We have care to decrease inflammation, stabilize the joint, and help repair tissue damage. Each one of these different services will have 2 to 3 different options. Once you complete the assessment and determine the specific options available for you to get out of pain and repair damaged tissue, we will write out some options for care along with the fees so that you can determine which route is best suited for you to address your knee pain. If you are not a good candidate, we will let you know immediately so that you do not waste your time or money. So depending upon Mr. Jones' response, you will know how committed he is to understanding his options for addressing his knee pain. This is not much different than when your car requires work and the mechanic tells you to bring it in so that they can test it to find out what's wrong. I do have to say that well over 60% of the people I see travel an hour and a half to 2 hours, and our system for handling them is a little bit different, and I will more than likely share that with you on a different video. The takeaway from this response is that the potential patient needs to understand that until we receive more information, we don't know if you are a good candidate for our services, let alone which particular services are going to be best suited for them. Before we jump into the next question, I want you to know that one thing I help practitioners set up is a system that will have people reaching out to you as opposed to you chasing after leads. The more you chase, the more desperate you appear. That's not for me, and I'm sure that's probably one of the biggest reasons I see practitioners get burned out. I help offices create a system based around the type of practice and patients they see, where patient education begins before the in-office consultation. I can help you create a system where there is a steady stream of umbilical cord stem cell patients chasing you. The best part is that if you qualify, this service can be complimentary. Let's move on to the next question. How long will it take for me to feel better? This is very important that you handle this by either sharing your experience or, if you are a new regenerative medicine office, sharing what is common in the industry. You must be sure to manage patient expectations. Mr. Jones, most of our patients begin noticing a meaningful change between 2 to 3 months from the different injections we offer. Some will respond sooner and obviously some later as a result of the fact that some people have more damage, different lifestyles, different body chemistry, and display different degrees of health. I want you to be aware that there is also basically other care available for you to feel better in a shorter period of time while you're waiting for the injections to repair the damaged tissue, reduce inflammation, and reduce your pain. During your assessment, we will be able to determine what options may be available for you to speed up the pain reduction process. So, this discussion now with Mr. Jones needs to be honest and open. If your patient for any reason at all is expecting a quick fix and you do not clarify the proper expectations, you are going to be putting out numerous fires in the future. Each patient has a unique metabolic profile, chemical composition, and immune system capacity. Make sure that your prospective patient understands this. How long does it last? This question is often related to the concern that an individual will require frequent umbilical tissue injections, requiring more time to alter their normal physical daily activities, as well as the obvious concern of overall cost. Bottom line, tell them what you know. Mr. Jones, I have people that still refer to us because they received our umbilical cord stem cell products back in 2017 and 2018 and still feel amazing and live their lives as they choose. Obviously, everyone's response will be different. Your information we obtained during the assessment, your lifestyle, degree of health, are all going to play a factor in your ability to respond. During the assessment, we can see if you would be a good candidate and which particular services and umbilical cord tissue injections will be best suited for you. At that time, we can make sure that your expectations will be realistic based on your assessment, your imaging, and similar patients that we have seen in the past. And now for the last question that I will address on this video is, how do I know it's going to work? You're going to get this quite a bit. Chances are this potential patient has been told, perhaps even promised by other practitioners before seeing you, that they were going to resolve their pain. Instead, what this person experienced was a bunch of wasted time and money. If you start spewing the same promises and expectations that they heard from other offices, they're probably not going to move forward with care. Of course, you're going to be respectful for what they have gone through. Give them options to move forward, but one step at a time instead of promising the world to them before you have even done any type of exam or understand exactly what you're dealing with. Mr. Jones, we have seen hundreds of people with knee pain, but at this point in time, I don't know if you are even a good candidate for any of our services. What I can tell you is this. Our office policy is that when you come in for the assessment, we will only accept you for care if you experience either an increase in motion, increase in strength, or a decrease in pain during the assessment. This will help take out the guesswork of wondering if we're going to be able to help you. If you do not experience at least one of the improvements, then we will not accept you for care. We prefer to take things one step at a time. As long as you experience an immediate improvement, then we can write out for you, say, 2 to 3 options for care to help you get out of pain, repair the tissue damage, and get you back to the point where you can spend more time enjoying the activities you love with the people you love. I just covered the 6 common questions often asked during the consultation for potential patients that are interested in receiving umbilical cord tissue products and stem cells. This is only a small part of what you need in order to develop a steady flow of umbilical cord tissue injections. So whether you are just learning how to start a stem cell clinic or trying to grow a regenerative medicine practice, be sure that you or whoever is responsible for addressing these questions is properly trained and understands how to respond accordingly so that you will see your sign-up rates increase, referral percentages begin to rise, and in time you will be generating 2 to 3 new patient referrals each month. To learn more about how to start a stem cell clinic or improve upon patient education of an existing regenerative medicine practice, be sure to subscribe to this channel so that you don't miss out.